Hello, everybody. This is a very important topic for forensic medicine in third year MBBS. So, let us dive in directly into the topic. What is medical negligence? So, medical negligence is the failure of a doctor to exercise reasonable care, skill, or knowledge which causes harm to the patient. It is both an ethical violation against the duty of care and a legal offense, that is, civil or criminal liability. So in India, majority cases are civil, whereas if we consider medical negligence, but there are also criminal cases registered against medical negligence. So the duty of care, that is the vow that the doctor has taken to give utmost care to the patient, where there is a breach of this duty, it is an ethical violation. So there are four elements of this medical negligence. So it is this is, mnemonic is three D's and one C. The first D is duty. A duty. Doctor owed a duty of care to the patient. So duty means a doctor is having is it is a duty concerned to the doctor about the patient. Then the second D is dereliction, that is breach of the duty, that is act of omission or commission. So what is act of omission? So act of omission is uh, not doing something which is meant to be done. Like for example, if I have something that is called as vaccination. So in vaccination, we have to not only give the vaccines, but we have to administer the care which is required for the patient. That is basic sterilization of the surface of body, whereas if it is IM or IV. So if this is very important, and these are some mandatory protocols that you have to follow, and not following this is called as act of omission, whereas act of commission. So what is act of commission? So whatever a doctor does that is not supposed to be done. For example, cut practice. If you know what is cut practice, that many doctors do it. It is illegal, but still people do it. So this is not supposed to be done, but still doctors do it, and this might lead to uh, termination of their medical license. Then damage. So damage, that the patient has suffered from an actual injury, which gives problem to the patient. And then these are the three Ds, and the last C is causation or caution, whatever you prefer. Direct link between the breach and the injury. So breach is like stopping the care, or just terminating the care, or putting a gap, and the injury is what patient suffers. So there is a direct link between breach and the injury. So here are the types of negligences. So the first one is civil negligence. The description: it is a private suit by patient for compensation. So it is not very rough thing like criminal negligence or gross negligence, but it is also important because it is very common in nowadays practice. Example: improper wound management. It is very common in government sectors, or somewhere where there are so many patients that you don't get time, or you don't have a lot of uh, like, if you know what I'm trying to say. So this is civil negligence. So private suit by patient for compensation. The compensation is done within the limits. So if my so this is the right of a patient to pay and get the duty, or uh, get the treatment. So if that treatment is incompetent, then the patient is legally acceptable for compensation. Then the second one is criminal negligence, that is gross negligible punishable. Gross negligence, that is punishable under Indian Penal Code. So now they have changed IPC to PNS, that is Bharatiya Nyaya Sanhita. Uh, Before it was Indian Penal Code, IPC. So it was changed in 2023. So you can go accordingly. For like recent times, even if it is nearly the end of 2025, still people prefer IPC 2. So you guys can do both. So for criminal negligence, that is performing surgery while being intoxicated. So you might have seen that in so many movies that they highlight this thing, but this is very wrong. You shouldn't do it. Then we have the gross negligence, that is extreme lack of care or competence, that is wrong patient surgery. So if you know that, see, humans do tend to make mistakes, but these are very big mistakes. Like if a patient is, for example, if a patient was given elective surgery for appendicitis, for appendectomy, that is laparoscopic, but the names were improper. So if I have a patient named as Bhagat who has been opted for elective uh, appendectomy, but there is another patient whose name is Bhagat, and they have not put any surnames for both the patient, and he had opted for a hernia surgery. Then wrong patient surgery is possible in some parts of, like, it is not only in India, but it is there in so many other places in the world. And this does happen because it is a human error, but this is punishable because this is wrong. Then uh, let's go further. So, uh, so gross negligence is the extreme lack of care or competence. Competence is what you learn from your experiences in your med school, then post graduation, and how good you are at your clinical skills decides your competence. Then contributory negligence. So this is other type of negligence which is very important, and this is very common actually. Patient's own negligence worsens the outcome, not taking prescribed meds. So, for example, if you have seen that there are so many Bollywood movies also on this. Like one I know, that Ankur Arora murder case. So it was regarding a patient was given NBM, nil by mouth, before the surgery, but he had biscuits before the surgery, which was by his mistake, and it had become a big case that is passed away or something. I didn't watch the movie, but I know the plot. I'll definitely watch it once. Okay. So contributory negligence, that patient's own negligence worsens the outcome. So not taking prescribed meds. For example, you guys must have seen that hypertensive patients and diabetic patients. So these are some diseases, hypertension and diabetes. So in other diseases, if the if this is a disease and this is the progression of the disease, if it goes up like this from a baseline, then the pain, P is the pain. So pain also worsens with the progression of the disease. This is the progression of the pain. But in hypertension and diabetes, so HPT and diabetes mellitus, these are some non-communicable diseases, as you will study in PSM. So hypertension and diabetes, the uh, duration of the disease is very high, but the progression is very quick, but the pain associated with it, pain starts very late. Like this is the baseline. So it will start like this, like this, like this, and on the end stage, it will give upscale. It will become upscale. It will increase. There are some diseases which have the complications. The complications are very common because of diabetes and hypertension. So some patients don't take their prescribed medicines because they think that they are very fine, but hypertension and diabetes are hidden diseases. You will study about iceberg phenomenon, which is very common in hypertension. At least hypertension is the best example of iceberg phenomenon. That, for example, I'll teach you now. So what is iceberg? So this is the ocean. This is the tip of the iceberg, and this is the bottom portion of the iceberg. So this is what a surgeon or a physician sees, a doctor sees, or the patient sees, and what we can rule out from the diagnosis and all, etc. But this is the entire progression and entire prognosis of the disease, and there are so many uh, complications after complications, as in there are so many uh, other diseases which are because of diabetes and hypertension. As you might be knowing, India is diabetes capital of the world. So we should keep track on our blood sugar level and our blood pressure, and that is very easy. So at least this generation should understand, so we can pass it on to other generations, and we can uh, make our older generations to uh, we can give them knowledge about these things, so that would give a better outcome. This is what I think. Then comparative negligence. Let's come back to the topic, okay? Comparative negligence. So the fault is shared between the patient and the doctor. So this is a comparative negligence. Comparative negligence means, uh, if you have heard this thing, that ताली एक हाथ से नहीं बजती, you have to give both the hands uh, for clapping. So comparative negligence is the fault that is shared between a patient and a doctor. So what about the doctor? So a doctor give has to report to the OPD. But if he comes late, or if uh, he isn't able to come, then it becomes a doctor's problem. Whereas for the patient, uh, if the patient was given a follow up, was asked for a follow up after 1 month, but if the patient doesn't show up, then it is a fault of the patient too. So this becomes a shared fault. Then next one is vicarious liability. So this is a very famous term. Vicarious liability means hospital held liable for the employees act. For example, there are big corporate hospitals in our country, in the major cities and all. So, for example, if there is a hospital X, and my employee is Y, so if a hospital is a big constitution, and if a small employee of that hospital does any big thing or a big blunder, the hospital itself is responsible for this thing. So, for example, nurse gives a drug dose, so the hospital is held liable for that. Then professional negligence. So this is not a big. This is not being made a big issue in court, but this is very wrong, because uh, doctors are trained for this, and if we miss on things like this, uh, the respect given to the doctor will not decrease, but the outcome of what you are trying to learn and what you are trying to provide will definitely decrease. So this is professional negligence. So doctor acts below accepted standard. So there are certain standards set by each and every country, and in fact by WHO, for example WHO. So they put some standards that has to be followed by international organization and national government and all. So if a doctor acts below that standard, then that becomes a problem, and that is a very wrong thing. Then misdiagnosis without evaluation is example of professional negligence. So if I don't have time, if I'm a doctor and I don't have time, that doesn't mean I can't evaluate. I have to evaluate. If I don't evaluate and I give the diagnosis, that would be wrong, because that is not confirmatory at all. Then we have negligence per se. So what is negligence per se? So violation of a law meant to protect public, not having a valid registration. So, for example, negligence per se is like brief negligence upon things that is given by law and order of the country. As in, we have all have NMC registration, a National Medical Council registration. So this registration are given by the government to each and every doctor. But there are some malpractices like quacks, if you know what is that. Just Google search it. These are some uh, people who don't have the degree, but they still practice, and that is not authentic at all, and this is very wrong. And please avoid going to a quack, because you don't know what might happen to you if they prescribe a medication without any knowledge of the thing, of the disease. Okay, so violation of a law meant to protect public. So not having a valid registration. Then here is the last thing in this, which is very important, I think, and this is what my professors used to tell me. So this is res ispa loquitur. So the thing speaks for itself. That is obvious negligence. Like if this is a bottle, and if this bottle falls down, so the water will spill, and we can see the water is spilling down. So it speaks for itself. So what happens is a thing speaks for itself. Like you don't need to prove it in the court. Example: a sponge left inside the abdomen. So this phenomena is called glossy pyboma. So glossy pyboma is a condition which is because of doctors' negligence. So what happened if and this might happen, and this has happened so many times. Like I have not seen in my hospital. Thankfully, my college is a great college, and hospital is also a great hospital. So I'm glad things don't happen there. Like I have never seen a case of glossy pyboma. And so what is glossy pyboma? So if a person is in emergency and he has got intestinal perforation, so there is air under diaphragm. So this is the diaphragm. These are the lungs. So if on the left side, so on the left side we have stomach. So this is the stomach, and this is the liver. But there is a space. So when you will see the radiography of a PA chest or AP chest, you will find air under diaphragm on the left side, which is because the gastric air, means the gastric part of the stomach has a little bit air, which is seen dark color on the radiograph. But on the right side, if it is present, that is above the liver, beneath the diaphragm, that is very risky thing to happen. That is intestinal perforation, and the patient might end up in a very severe damage or even death. So immediately the surgeons are being called, and you have to do exploratory laparotomy. So it is entire incision taken on in the middle of the abdomen, so leaving the umbilicus besides. So for example, if a doctor fixes this, but if there is time constraint and a little bit of loss of attention or distraction might cause a sponge to leave inside the body. And if this is a sponge which is left inside the body besides the intestine, it might cause a big problem. And because of infection and granuloma formation around the sponge, it forms not granuloma to be honest, but pus ball or something like that that forms, which is called as glossy pyboma. So this is also big medical legal case, and your license might be cancelled because of this thing. So let us continue further. Legal provisions related to negligence. So let's see this. IPC section 304A. So description of this section. So this is subsection A of IPC section 304, that is causing death by rash or negligent act. So technically, if you hit someone with a vehicle by an over speeding vehicle, that thing also comes like if you hit someone and the person has died, then the case which you get upon is 304A. So this is the same for death by rash or negligent act. Then IPC section 337 338, that is causing hurt, grievous hurt by negligence. So hurt, so if you open your forensic medicine textbook, you will understand about hurt and grievous hurt. So we might continue that in further lectures. Let's see. Then COPRA. So this is Consumer Protection Act. This is definitely going to come in upcoming lectures. So patient can sue you for deficiency in service. So if a patient pays you, then you are opt to provide a service to the patient. And if you don't do so, then the patient might uh, pull you to the court, might take you to the court, and their Consumer Protection Act is applied on that case. Then we have volume test. A doctor is not negligent if their action is supported by a respectable body of medical opinion. So, like NMC, there is National Medical Council, and other government bodies or medically respectable bodies in the country. So there is a very famous case, Jacob Matthew and State of Punjab versus State of Punjab. So landmark Supreme Court case defining criminal negligence. So you can watch any video regarding to that. This is just for an example actually. So we'll continue further. Ethical principles linked to negligence. So there are four ethical principles. So first one is autonomy. The meaning of autonomy is respecting patient's decision. Like a patient is a human and every human has a right to decide what he has to do. So, for example, not informing a patient properly. So, there are so many, for example, if we say hysterectomy, that is removal of the uterus from the body of a woman, because of so many things, like there are multiple reasons to this. So, what happens is there are many, hysterectomy, we have so many routes of removal of the uterus. One is laparoscopic abdominal hysterectomy, then open abdominal hysterectomy. So you take an incision. Then we have vaginal hysterectomy, that is uh, from the vagina, that is done from the vagina. So if the patient knows about laparoscopic, see, laparoscopic is very safe and the recovery time is very fast. And older patients, like above the age of 70 or maybe 50, 60 also, if they have some diseases, it is very common laparoscopic abdominal hysterectomy. So the patient knows about this thing, he or she will never opt for open abdominal hysterectomy. So patient has a right to know everything about the case, like all the possible. Also in appendicitis, if the appendicitis is not very severe, it can be managed by uh, medications like medical management, and surgical management is not always necessary. You can also conserve it via medicine if it is very subtle. Then and it depends upon the patient, like whatever patient has to do. Then beneficence, so act of patient's best interest, not giving appropriate treatment. So some doctors do practice it, like if a surgery costs around 3 to 5 lakh, and if there is another surgery which is best for the patient, but it costs a little bit less than that, like 1 lakh of maybe 80,000, then some doctors do go for higher valued surgery because this will benefit them, and this is wrong because if a patient does not have that much financial capability of paying that much money, then they'll land up in taking loans. And there are government schemes, but if there is no need of giving a big surgery as an elective option, then you can definitely give patient what is best in his interest or her interest. Uh, the non-maleficence. This is do no harm, that any act of causing injury or harm to the patient. So this is pretty much self-explanatory. Then justice. So fair and equal treatment, like denying proper care and discrimination. So this is very important because uh, fair and equal treatment is a right of every human, devoid of him being rich or poor. So all the basic, if a patient is going to die, a doctor shouldn't be seeing his or her financial capability to pay. So fair and equal treatment should be given to each and every case, even if the patient is rich or poor. Okay, so this is it for this lecture. I know the lecture was very long according to the topic, but I thought we'll learn it properly. So next time we'll complete this. What is Copra? Okay. Thank you. Subscribe to my channel. This was my first video. That's why it is so long, because I was so confused what and all I should add. I hope it was nice. I'm sorry if I made any mistakes while teaching. And please do read your textbooks because that is also very important. And do revise these topics. Thank you. Have a great day.